center. We provide a means for the veterans to have access to their kits, because a lot of times they come back, they have substance abuse issues, mental health issues, and through us, they can spend a quiet hour, 2 hours with their child.
Stephanie Tabor. I'm a caregiver for my vet. He did 3 tours, and I was married to him for each one of those. I'm just here to learn more so I can help him more.
Great.
Well, I'm Donald Tabor, retired Sergeant First Class, 22 years, served in the original Desert Storm, 03, 04, right after 9/11 in the airports for 18 months, and also I went back again in 2009 and 10. Currently with the VA, PTSD, taking medication, and I'm also going through alcohol addiction problems, trying to get over that. Currently work at the state hospital. I'm going to Ivy Tech. I'm 6 classes away from my associate's degree, and plan to move on to USI or UV to into social work.
That's great. I'm Peggy Tweedall. I'm a retired nurse for 1 year now, and proud wife of a Vietnam veteran. And we're here just to learn what they have to offer.
Mark Tweedall, I'm a Vietnam veteran.
Guess you can put that together.
Great, I'm glad to hear.
I'm Kim Keenan. I'm the military liaison for Lincoln Trail Behavioral Health Hospital in Radcliffe, Kentucky, just outside the gates of Fort Knox. We're a 140-bed acute psychiatric facility, and we have a 30-bed unit that's specifically for veterans and active duty service members, treating the mental health, the substance abuse, the dual diagnosis, and particularly the PTSD. I also serve on the Kentucky Suicide Prevention Group Committee.
Last but certainly not least.
My name is Janice Stover. I'm a nurse, behavioral health nurse for VA at Brianna, and I just love my job. It's the best nursing job in the world, and I love it. And I get to work with a lot of very, very talented people, and glad to be here today.
Great. Okay, Lori, I've been instructed that you must sit here.
Okay.
And yeah, why don't you have to go there? So how I understand this is going to work today is we have a series of scripted questions that we're going to ask Lori, and I'm going to sit over my side. So we're going to go through and ask Lori, and then hopefully this will prompt some additional discussion. But the whole point of these questions is to just get Lori's, and since we have other veterans, I think it'd be great if you guys want to pipe in and give us your feedback too. But get Lori's take on some of these different topics as we go through. So without any further, and by the way, I'm supposed to take notes and do a little briefing when we get back into there as a group. So again, the idea is any information, any brainstorming, ideas that we can get on ways to improve our services and get that feedback from our veterans. So, okay, so Lori, the first question, as you were experiencing your road to recovery, what community and VA services worked for you?
I would definitely have to say the HUD-VASH was a turning point. I'm online student. I'm about a year away receiving my bachelor's for substance abuse counseling, and I was really struggling with being able to pay rent and hold down a household and go to school at the same time. It was also my whole life I've been beat on by my mom, every significant other, and then my son. And at that point, I was starting to shut down. I didn't know where to turn. And I had to study. I had to figure out why people do what they do. Why do they self-medicate? You know, how did my son turn so ugly? this loving person. And so I started taking the substance abuse counseling, and about a year away. My goal is to help other veterans and help other people.
So if I hear you, HUD Bash, but I also hear, and you mentioned in there also as well, that college, secondary education has been important as well.
Vet Center, and because 21 years ago, I had 3 traumatic things, and terrible things, within 2-month period. And so I was, from when I was little, my mom was very volatile, and so things would happen, and you'd run, and then act like nothing was wrong. The generational pathology of things. The Vet Center, about a year ago, I started having the nightmares, and had been clean for 2 years, and didn't want to go back to substance abuse again. I had to fight to stay out of that, and I started going to the Vet Center, and they've been amazing. I've got amazing help there.
Great. So I'm hearing community college and Vet Center and HUD Bash. Oh, that was great.
Trying to make it a little bit lighter.
Yeah, that. Okay. And I'm just curious, is there, since we have our community college represent, and the Vet Center represent, anything in particular about the Vet Center services that they received, or about the community colleges or HUD Bash?
I got a lot of help from Ivy Tech, and then I had moved to Vincennes, and then I came back. While I was in Vincennes, it was terrible, and I knew I had to get out of there because I went right back to substance abuse using. So at that point, I knew if I'd get that HUD Bash voucher, and I told them that first appointment, if I get this appointment, if I get this apartment, I'm done. We won't have to worry about the substance, and I have it. Then 2 years ago, about a year ago, that I started having all this trauma from 20 years ago that I never dealt with. You have to deal with it to heal it. You just can't shove it under that rug. So she's done amazing work today. 21 years ago, I did come to Evansville, and I went to New York. I don't even know where it was. I don't remember. But it was turned away because I didn't have any insurance. At that point, I didn't even know the VA had a behavioral medicine. So that would have been helpful if they would ask me, are you a veteran? And then, directed me that. It was by the grace of God that I made it through that time, because every minute of every day I wanted to die. I tried several times.
I think that's another piece that we always hit on, is the coordination of services. A lot of times, I think we have great resources, but sometimes in our community, and I've said it several times already today, sometimes we get kind of stuck in our little areas, and trying to coordinate and work together is sometimes hard to do, because we have our own agency and the way their agency's set up, and getting out. The VA is a whole lot better than, within the past 10 years that I've been here in Evansville with the VA here, there's been huge changes. I mean, this is a perfect example. We were really pretty much in our own little cubbyhole and not allowed to work, not even encouraged with them to work and communicate with you all. But that's changed dramatically in these past 10 years, and now we always tried to do that, but it was much harder to do than it is today, because we have all these outreach mandates. So that's really a big change for us. Any thoughts or comments, either the veterans or any of you all, anything you want to add with regards to those services?
I just want to say a thing about being turned away really bothered me, because I remember, especially when there was the school shootings years ago, I said, I don't want to get into gun control, but I said WUDAC, adequate and affordable mental health treatment and substance abuse treatment. So I didn't know all these services were available. So I'm really, I'm very enthused about that, because we need that.
I think, correct me if I'm wrong, but I think because of our collaborations, both of your agencies do a lot now that might not have been the case 10 years ago in terms of making sure that we're looking for veterans, and I think we work together a lot closer than we did before. So when someone gets hooked into your agency, goes to your ER, I think there's things in place that weren't in place before. So I definitely think there's an improvement for 20 years. When you consider how things are now today compared to 20 years, I think there's been a big change.
I think also too, it's surprising, but I think even people talking more about mental health in the last 20 years has opened a lot of eyes too. Because I mean, our service has been in Evansville since 1971, and we started with 736 patients, and today we have over 12,000. So it's like that growth of awareness and people actually having the conversations they need to have and willing to refer their family members and friends to all of our various services are really helping open those doors. It's kind of, the cancer of the 1950s, no one would ever talk about cancer. Today, people are wearing team shirts to support their loved one with cancer, and mental health will get there. But it just takes time, and I think as, more and more people become aware that mental health issues are just as important as physical health issues for somebody's whole wellness, that we will achieve that and continue to have better results with people getting the treatment early on and not waiting for long.
Any other comments or thoughts?
I kind of, something that Lori kind of brought up, that in the military, you're taught to be to the point where they build you up, that you're, the super person, the super soldier, and you're not allowed to show any kind of weaknesses. And I think that's where the breakdown could be, because a lot of people out on the outside, the soldiers and veterans, think they're weak if they admit there's something wrong. So therefore they don't seek the help, until it's too late or things have gotten really bad. So that's kind of the way I kind of look at it, because it took me a long time to overcome that.
If you've got a vet asking for help, they've probably been struggling for a long, long time because they just don't ask for help. They were never allowed to. You don't do that.
Right.
I think that's been a big benefit with behavioral health assets in primary care too. With those vets that continue, to avoid and don't really understand what they came home with. The primary care physicians are able to see that and walk them straight over to a psychologist that can kind of explain things to them and give them a little bit of insight on what we all came home with.
That's actually how I got headed in that direction, because my health started getting messed up because of stress and anxiety, PTSD. So I had a bleeding ulcer, and I actually got Lifeline there in 2007. At that point, they were sending me to behavioral medicine to give me Ativan, and I don't want to take that Ativan, but I had to at that point because I almost died from that bleeding ulcer. I mean, I came within inches of dying. And so that's how I even found out there was behavioral medicine at VA. I didn't know. Yeah.
Do you recall when you say you came back and you could tell your health was falling apart? Could you discern at that time, was it physical symptoms, or was it more coming here and then that played out in your body, or did your body play out and contribute to your mental? You see what I'm saying? Do you feel like the reason the anxiety at the mental level helped create the ulcer at the stomach level, or did you feel a physical deteroration that you felt kept playing on the mental area? You felt that that's the way it went?
Stress and trying to hold it all in and act like you're normal, and I call it the noise in your head.
Noise in your head. Thank you.
So.
Okay, so if I don't get through all these questions, Nikki will come and get me later, so I'm going to make sure I have all these questions, okay? So what barriers did you encounter when attempting to obtain services, and what did you need that you could not find? So, I mean, you mentioned that a little bit, but you want to elaborate any more barriers?
I was gonna say, if you've got a veteran that's coming and asking for help, you know, like if you're at Deaconess or one of them, I wonder if I wasn't at Mulberry Center, because it was that long time ago. But I was never asked if I was a veteran. I never knew that there was some veteran services available. And if you got a vet coming in, they've probably been struggling with this to the point where they can't do it anymore. There's other things that are falling apart.
Okay. What did you need that you could not find? Anything that you can think of?
I pretty much somehow, some way stumbled in. I think
Yeah, you're a pretty tenacious person.
I'm telling you, well, God has His way too, you know. And God's not done with me yet. He's got more work for me to do. I know He does. So He'll help you stumble into that one way or another.
Any thoughts about barriers that you've encountered, Mr. Tabor, or things that you need that you couldn't find?
I don't know. It's been since I've come forward back in 2010. I've had really no problems with the VA, working with Nikki Presley, yourself included, Daryl, going to Stepping Stone. I've been to Brentwood Meadows, Stepping Stone, Jefferson Barracks. They really worked very well with me. Like I said, I've had no real major problems finding the help, but the problem I had was admitting I had a problem and admitting that I can't handle it, to the point that where my marriage was going down, couldn't hold a job, had all those symptoms, the noise in your head that was a big. And with the medication that I was getting, I got from the VA, it all kind of worked out right now.
How about the rest of you? Any thoughts about barriers that you think exist? I mean, we mentioned a little bit about, coordinating of services and collaborating. I think that the Tri-State, I'm going to say it wrong.
The resource.
Yeah, the resource group that's meeting on a monthly basis. So we have.
The Tri-State Military Resource.
There we go, Tri-State Military Resource. Yeah, I mean, that's a perfect example of us pulling together and that kind of thing. Any other ideas or thoughts?
There was also a program about 6 months ago, I think it was in December, and it was hosted here at USI with Major Matherly. It was a veterans for job.
Ready? It helped you with resumes and
readiness.
Yeah,
Yeah,
job readiness.
and it was like a day-long thing, and that really helped me because then they helped me do a resume, and it was right after that when I sent my resume in, I received a job at the state hospital. I've been working there ever since. So something like that really helps also. I can't remember the exact name of it, but it was something hosted here, and it was very informative, and it really helped.
And it was also conducted by other vets. I think that that's important too. The veteran helping the veteran. They can really relate to one another.
They know where you're coming from, what you're talking about, what you're going through.
Laura, I first want to say I applaud your resilience. Keep focused on your studies in terms of getting into the professional field, because I think to piggyback on that, in terms of the challenges that we face in terms of veterans, is that the military breeds stigma in and of itself because we are trained for certain missions and we keep it within house and we take care of one another. But then when we separate from the military, there's the if we experience issues, we kind of keep it within ourselves and we don't want to acknowledge that. And all of us know that as professionals, if you're not military, you still have a wealth of knowledge. But for some veterans, if they know that there's a former, Pell veteran who is in a role that can kind of bridge that gap to get them at least initially engaged, then you start to see huge benefits, and the veterans kind of start to explore other professionals in terms of, hey, I think they can assist me as well. And so if we can bridge that gap with them, that's huge, because I just have so many family and friends that will not engage in services because their mindset is they don't understand. And so we've got to continue to work on that, and I think that we're getting there, especially the VA and hiring peer supports. I mean, I think that's huge, but we got to continue to work on bridging that gap.
Okay. Anything else?
Last thing.
Sure.
I think some of the barriers we did a community assessment that we found from the people that we surveyed were that unfortunately sometimes the mental health is so specialized. It's not like a clinic or a hospital where you go in there for any reason and people don't know why you're there. But when you come to one of our facilities, you're there for mental health or addiction. If you run into somebody, your neighbor, your church friend, whoever, they know why you're there.
Yeah.
And the other thing too is that people still believe that mental health is so expensive. They think they can't afford that therapy or that treatment, and so we've ran into that too, the barrier. Still that illusion that it's a very expensive type of specialty.
I think convenience to care. I think it's been a great thing that the VA is doing behavioral medicine inside the same village. I think when veterans come in for help, and you say, hey, I got an appointment for you tomorrow with behavioral health, and it used to be across the street, that you found a lot of veterans, at the time that they need help, they need help. And, if you give them, with the avoidance that you find with PTSD, if you give them 24 hours, 48 hours to drive up to a building and sit outside there and watch other people walk in, a lot of times they start their car back up and leave. They talk themselves out. And so I think for a lot of us, I think it helps that if we're able to provide those services immediately. And again, not to go back to primary care, I think that's why it's so important that primary care is there too, to build that rapport when they're ready for it.
Quite honestly, they usually go home and self-medicate.
The VA definitely acknowledged what you're saying, and in fact, we have mandates where we have integrated mental health primary care into the primary care clinics, and there's all kinds of monitors now that with screenings that our primary care docs have to do that trigger involvement with our integrated care at the VA. So we have a lot of, I think that the VA may, Vietnam vets probably, I know a lot of them are, it's hard to see that these things have taken so long to take place, but they've taken place, and now we do have, all kinds of options that we certainly never had before. Even in the past 10 years, that's a new I remember how hard we were working to try to be available to manage walk-ins before we had this program of primary care. And then certainly when our clinic got so large, they forced our mental health, we had to move our whole mental health in a separate contract because there was just no room for us to be in the old clinic on Walnut. So, but now that we're all under one big building, it's a whole lot better for us, and we've got a nice facility now. So. Okay. Anything else you actually? Oh, we have a question from our folks in their notes.
Okay. Okay. Where does a veteran start, and what are the risks, such as having a label and trying to move forward with employment?
Any thoughts on that?
Is mental health treatment, that would be a violation of confidentiality? You don't have to let your employer know you're receiving mental health treatment.
Yeah,
I thought that was the case too, but I've been told differently that it can be found in records. If they do look hard enough, it can be found in the records that they've got mental health treatment. Because I didn't know that either, but I've been told differently.
I think it's a vehicle violation because at our facility, they sign a consent form for their physical treatment, but if they're seeing a mental health provider, there's a separate consent form that they sign, and nobody can know about that.
Do you have any thoughts on this? Can you read the question again?
You bet. Where does the veteran start, and what are the risks, such as having a label, when trying to move forward with employment?
Do you guys have any thoughts on that as a veteran?
Go ahead.
Well, I'm just speaking coming out of the military and having an experience working with the SSBF program prior to coming to Western State. As far as employment goes, I think when a soldier or service member is first transitioning, one of the first places they tend to go is the unemployment office. Well, what I've come to find out that at the unemployment office, depending on what you fill out on your paperwork, you can be denied for unemployment. If you put some things on there in reference to mental health or certain types of treatment, and that is the place where a lot of them will go for employment opportunities, because normally there is a VA rep in the unemployment offices that you're pretty much told when you get out and you go to the unemployment office to go see that representative. And in the meantime, you're trying to get the unemployment to kind of transition. So I have recently found out that depending on what you say when you go for unemployment benefits, you can be denied unemployment. Is that what you ran into?
I was too. I went down to work one and filled out all the paperwork, and I worked for 20 years at a company. I was denied unemployment, and thank goodness I had already started receiving my disability money, the monthly money that I get, because if not, I mean, I would have been devastated. We'd have lost the house, the car, everything.
Okay, I'm not sure.
So where do you start?
Well, I guess one of the things that I think it's fine, we can talk about it in here, but I know that I'm wondering if the person that asked the question, because we are focused on the mental health piece in here.
They need to start at the VA. They need to get down and they need to make appointments. They need to talk to the provider, but then they need to see the behavioral health if they are diagnosed with something, and start from there, and then work towards the employment, because you have to treat the problem. You have to treat whatever is wrong, PTSD, TBI, whatever the problem may be, because if you don't, keeping employment is going to be very difficult. That's my experience.
And I kind of brought that up too, because you say, where does it start? Well, we are taught to go to the unemployment to start our employment agencies through our interaction with trying to get a job through the unemployment office. So if you're denied unemployment, then you get shut out from being able to go see that VA rep that's there to help you with employment. So that's kind of where, like he said, and when it's like that, a lot of people on the outside are not going to be able to help you because you've already been shut out. And then the only place you can go is to the VA. But this is where I think it starts at transition, because if you don't have people on your military post who are willing to tell you the things that you need to know, then as far as you claiming disability, as far as a whole lot of things, you're just going to constantly hit walls. I got out in 2004. I didn't even get a rating until last year. For now, I'm actually rated at 10%. So I did not have access to a lot of things because I was not a veteran considered with a disability.
I think another thing, having just gone through this with my husband as we separated and retired, I think that the military has recognized that they were not doing the best job in coordinating services. So, like, we know that the VA in many of the locations now where veterans are being out processed when they're retiring or separating, they now have VA employees that are embedded as part of to do those assessments in the front end of that discharge. And I know that there are more and more, just like USI, their efforts they've done out here, Work One, and then there's lots of different groups, VSSC, that are popping up doing a lot of things. So I think that since your separation to now, I think that and I'm trying to remember, the Army at least has contract. I can't remember the acronym, but it's the program that's designed to help veterans or help soldiers that they're separating out. What's it called? ACAP, yes. And then I think Air Force has something comparable to that. So, I mean, I think that they're building their ACAP program a lot more than what they had before. Yeah.
And also, this is my first time even hearing that this exists, and maybe this would be a good place or a good start. That I do think that each, like Fort Knox, Fort Campbell, we now have in position things called MFLACs, where the behavioral health and everything is becoming something of more interest with the MFLACs. But just like he said earlier, yes, the units have MFLACs that's embedded, which is military family life counselors. But when, as the soldier, you're pretty much, even though they're supposed to be there, it's supposed to be confidential, and a soldier can go in and speak to this person who is a licensed social worker or someone in therapy that used to have their independent practice, but now they're working for the government inside these units. They're pretty much told, yeah, you can go see them, but chain of command is going to say, but you better not say this or you better not say that. And I think maybe from this point on, that it would be a good idea to include them in this training, because they can be the inside source embedded in these units, especially with soldiers transitioning. And then they even have them at the high schools and the schools to work with the dependents of the military community as well. So I think a lot of it has to do with, just like he said, being brought up a certain way to believe that we're not supposed to say that we're mental or we have mental issues. And even though they have people in place, they're still limited as to what they can say and do too. Because they may not know a lot of the outside sources. It's still right within that community that they share things. So with the employment and just everything, it can be really hard to admit that you have a mental health issue or you feel as if you do.
And I think you're exactly right, Officer Johnson. A lot of the vets that I see coming out of active duty now, they have vastly changed the way that they out process. I mean, I see guys and girls that already have their disabilities in place. And I think one of the big failures is, as far as employment and other options, is a lot of times what happens is they come out, they have disabilities which open up the door to other services such as both rehab and things like that, and they don't know about them. They don't understand some of the benefits that they have that might help them with employment when they're coming out.
The other thing I was saying, Rocky, well, several of you guys mentioned it. Aside from the disability part, I don't think that you can ever minimize, and because my husband and I have been going through this for the past year since he retired, you can never minimize how difficult it is to adjust from active duty military to civilian. It's a challenge. It's an incredible challenge. Because, like you said, it's the whole structure, and a lot of people join the military at a young age because, and my husband did the same thing. He joined the military because he didn't really know what else to do. He wasn't sure what else, and he immigrated from Cuba, and his parents were illiterate, so they weren't able to help him, so he connected with organizations that were easy to get connected with to find his way, and so everything has kind of been laid out during that process for him, and then when you suddenly retire, then you're like, well, what am I going to, what do I want to do when I grow up? And I think the other thing is, at least for even veterans that are just have just finished a 3-year tour, I think there's still a huge adjustment. So, I mean, I think the longer someone's in, I think that adjustment is more and more challenging. But still, I also don't think we can ever minimize that change that you go through when you switch your jobs. I mean, it's a major lifestyle change. There's no PX, no commissary around here. And I'm like, well, we have to go to the store like everybody else, And so that's kind of one of those things that spouses stuck doing this, you have to do the reality check sometimes, and then, okay, there we are.
There's a camaraderie.
Right,
You
exactly.
learn there's a camaraderie when you're inside in the military, and when you get out, there's nothing. You're just kind of like, oh, what do I do now? And you just feel kind of lost, and you're just out there, and you have no purpose. And for about 2 years, 3 years,
Once we found the programs like the folk rehab, he was
I was
able.
like that. But once I hit the voc rehab, you started going to school again. I had a purpose, and there's a structure.
Right, and then you can start
and-
making social contacts, right?
And that's
I mean, I think
exactly
that,
how I
in the
fit.
military, especially active duty, everybody knows that they're gonna be somewhere for 2, 3 years, and so you make, everybody's focused on making quick acquaintances and friends, and if you're lucky. And then that's gonna change, so there's this constant change, so everybody's real focused on making those contacts while you're there. But then when you move into, get yourself established in a civilian neighborhood, they're all been buddies since they were 10, and so trying to fit in that connection is a whole different thing.
And that takes you back to the Point Man,
That's right.
or the
That's
Riverwalk
right.
group that I belong to.
Point Man is really,
It really helps because you meet like once a week with other veterans and talk about, you just have a gathering, you bring a little food, and
Point Man has missions of things that give you the sense of purpose. So.
correct.
Okay, I'm really gonna get in trouble if I don't move on to questions. Okay. Next question, Lori. What kind of possible solutions can help remove the barriers that we've mentioned so far? So again, any other thoughts about removing barriers? We've kind of incorporated employment here, so, and we talked about, trying to involve the local military more when we do these trainings, but any other thoughts you have?
And another thing that opened up with me was once I went to got my EMT license in 2007, and that little taste of college, I knew that I had to do something. I got to do something. And they say that death and a new baby in the family will change your whole outlook. Well, I had them both within a month. I get this. I did it all at once, I guess. So that changed me, and I knew I wanted to go back to school. And then I got with the state voc rehab, and I just applied and am starting to receive the VA voc rehab. As far as, I think it has to become, like with the people that are helping these people that are discharging, that are getting out. I think a lot of them, they need to let these people know what it's available. I didn't know there was anything available for a long, long time.
Any other ideas about removing barriers? We've already mentioned some things here, so I'm trying to coordinate that.
I'm going to hit on something she said earlier because she's talking from the active duty view. I did about 14 years active duty, and the rest was National Guard. And when I got out, there was literally nothing. We had one little group. There was a bunch of little groups there with pamphlets, but there was nobody talked to you about anything really. They didn't tell you what you had to do.
You mean when you separated from the National Guard?
Yeah, and when we got back from that last deployment, and it was like, then I retired, and they don't tell you anything about anything. You just retire and you're done. And then you're like, so I think it's a little more difficult for the National Guard and reserves to find out anything about what's going
I
on.
agree
And
100%. I think the challenges that active duty folks have are, in many respects, very different from National Guard. Now, I will tell you this, when my husband retired and he had to do his out process in Fort Knox, he said that there was reserves and National Guards in there all, so I don't know if they have started, bringing the National Guard and reserves to an active duty facility to out process them, if that's a new thing that they've done, but I know that he said, this was a year and a half ago, he said the reserves and the National Guard were all there too, getting the same
something new,
information,
because
so
in
I have a feeling.
2011 it wasn't.
Right, I have a
anything.
feeling they've started to have it.
My take on that is it's an overwhelming amount of information that is given to you, and you're trying to retain it in a brief amount of time. When someone's in for a long period of time, I think that it's about linking it all together and continuing to follow up with them, not just, for the 2 days or the 1 day that they're given information. It's a process.
The guys were so eager to get out at that point. We had just gotten back. All they wanted to do was sign that paper, check the boxes off, and go home to their families. And they didn't even bother with any of that. They didn't retain any of it.
And the demobilization is different. I mean, I've seen it from both sides. I did 9 years reserve before my active duty time. And demobilization from the reserve and National Guards is totally different. And then it even comes down to, once again, what is the true definition of a veteran? After working the SSVF program, I found out that though that definition has changed, it still does not include a very large population of the National Guards and reservists. It just doesn't, because you have a certain time requirement to be in a certain area considered as boots on ground before you would even be granted that quote-unquote status of being a veteran. So if you are a reservist in National Guard and you deployed and something happened that you did not complete your time over there consecutively, you may have gotten hurt over there or may have come into some mental problems. You didn't meet that criteria, that there's not an option for you. The most you can do is try to go through Social Security and things of that nature.
The other thing I think that's happening that I think is really important for all of us to be aware of, because it's one of these hidden things that affects the folks that we see, but you don't realize it. The downsizing in the military right now is huge. Everywhere from active duty to National Guard to reserves to military contract. I mean, it's huge. We have friends, and they're, people that 5 years ago would not even be considered for being put out, are being put out now without a thought. Mm-hmm. And they're going to be put out with less, and also the military at the same time, especially for active duty, they're looking at cutting and changing the retirement benefits drastically. So when you put all this together, it's confusing for my husband and I were in the middle of it, but when you put all this together, it's really confusing for us to try to manage, because I think a lot of the changes are, they're just being rolled out right now, and we don't know how they're going to look down the road. But a lot of so the veterans have got a lot of pressure on them, and active duty guys, National Guard guys got a lot of pressure because they're being cut.
It's all very interesting. Something Mark and I were talking about earlier too is like resource fairs. We see one around the corner every week almost. It seems like we're trying to spread information about VA benefits and supports and things like that. And I'm just reminded again that you can never stop doing those, even when you think, well, everybody knows that stuff. They don't, do they? I mean, just hearing your stories about when you separated out and you were hurried up, you want to get out of there and get home, I don't blame you. I mean, you think, well, why don't they know about their education benefits? Certainly someone told them this. I think maybe they did, maybe they didn't, but they weren't hearing. They're not ready to hear it sometimes at that point. I wonder I've heard this before so much that sometimes people aren't ready to hear it then. Does the military ever consider about doing that kind of information that they provide right as they leave, maybe a year later, when maybe they're more interested in hearing about it, I think more able to hear it? You know what I mean?
Yeah, they don't, but I can tell you right now, and I don't know how many of the other veterans in the room are familiar with it, but I think that military's answer to this is some of these websites that we've given to you, especially eBenefits. Now, having gone through this whole separation process, that eBenefits website with my husband has been great, because you can tell where things are in the process of the applications and all the stuff that you can tell where it is. Before they have that, you can't. So
and that's through the VA, the eBenefits.
Well, it's a website
And it's
But see,
not the
some
VA
of the
benefit.
things about the
Yeah.
I
Yeah.
What is it, e-benefits dot?
So it's your VA benefits. If you applied for usage of some of it, you can see where you stand in receiving and getting it.
Yeah, you fill out the, you submit the application, you can submit all this stuff online, you couldn't do that before.
Okay.
And then you can see where it is in the process.
You can download forms that show that you have a disability from,
Even you're getting your DD 214, which used to be such a colossal,
Right.
overwhelming task, is, so, I mean, I think they haven't done what you're talking about, that follow-up piece. I mean, that right now it's kind of on the veteran to do that once they separate, but one thing's for sure, the e-benefits and some of these websites that you've seen in here, you know, the VA, I think is doing a better job of getting that information. Oh,
I'm gonna just go one step further. I don't want to keep talking through this whole thing, but, I'll tell you what, when I came back in 2010, just going to the store, like, the other gentleman said it previously, just going to the store was overwhelming to me. So to get on a computer and go through all that stuff and jump and do all that stuff, because I don't like computers anyway. So I'm like, I was overwhelmed. She had to do a lot of that. I couldn't do it. So if you got a soldier who's single, who doesn't have anybody, they're going through that trauma and coming right back off the battlefield. I mean, sometimes you come right out of the battlefield, you go through this thing, you sign some papers, and here you are at Walmart. And you're going, oh my God. And you're still way over there. And so a computer and all that, you need an actual person that needs to sit down and talk with these people.
I was talking with Work One earlier, one of the things that they said is that they're doing a lot more of that, like for job applications and stuff than they were before. So I mean, I think, and that, just like Ronnie was talking about, the peer support, I mean, that's why I think the VA recognizes that hiring veterans as peer support specialists who are in recovery makes a difference. And so using them in our clinic is.
And then going back to the question that was on the computer, the labeling, I know kind of what they're talking about, oh God, they're mental. Oh God, they got problems, we don't want to hire them. So I know exactly what they're saying because I went through a lot of that, but you have to keep pushing, you have to stick with it, you have to go to school, and you have to come up with a reason, and you have to get over that feeling that you're not alone, you're not weak, and you do have some problems, and you need to go talk to somebody because we're not worthless. And that's how I kind of felt for about 2 years after I got out. Just worthless. Here I am, what do? I have no unit. A lot of these younger guys are used to like the sergeant first classes and the first sergeants taking care of all their paperwork, so they've never dealt with all that. And that goes back to the thing you're talking about on the computer. You expect them to just jump right in and do it by themselves when they haven't done it the whole time through. So it's really hard to adjust to all of that. And I've lost a lot of friends since 2008 to suicide, just some as recent as a month ago. And sometimes it just gets too overwhelming for those people and they find another way out.
Mark.
Yeah, I just want to ask a quick question of Lori and the veterans and spouses. With regards to removing barriers, a lot of, it seems like almost all the connections you hear about are happenstance or fate, or it's just luck and persistence, I guess. Would it be helpful if all the different service providers had some type of common structure so that as you land at the employment office or the medical office, those folks can not only just give you more brochures, which is happening in more websites, but actually refer you 1 or 2 steps down the road, what might be a good follow-up. If you land at the vet center, and maybe this already happens there, but you land at the vet center and you're getting counseling, to refer you to Point Man or River,
it's a Point Man group.
Right. So, refer you a couple steps down the road in addition to what you're currently doing. rather than just giving you a bunch more options. You know what I'm saying? Would that be more helpful?
I think so. I think so. And she had mentioned the fairs, the resources.
Mm-hmm.
That has really helped me because a lot of these things I didn't know was even available. So that kind of thing does help.
All right.
I think what we can't lose sight of, though, is piggybacking off what that they're saying about kind of like the overwhelming aspect of separating. We have got to continue to get veterans to register, get in the system. Then if you can go to an appointment with somebody, put face to face, and then you can convey, I need employment, I need this treatment, I need this treatment, and then we can get you to the next person who is a live body instead of continuing to load us up with brochures and this website. And I mean, technology is good, but at the same time, it's really kind of desensitizing and it's distancing veterans, and they're becoming overwhelmed, and they just put that folder and they throw it in the trash or they throw it somewhere. Then they encounter problems, and it's like, well, didn't you get on that website? Get them to register. The VA will, even if you have transportation issues, if you want to register, all you got to do is call the registration office at Marion. I've got the number if you need it. They will send transportation to come get you. They will bring you to Marion. They'll ask you kind of just a series of questions. You don't have to go into the combat experiences and stuff. They'll just ask you just to determine eligibility. That will open up a lot of avenues in terms of, okay, I can see this person to talk about employment. All right, now I can talk about this person and meet with them, because technology is good, but we're losing that engagement phase because it is overwhelming.
One of the things that I know is happening here in Evansville, and some of you may know this, may not know this, I know there's kind of and maybe Rocky can explain it better, or some of those folks that are closer connected with the homeless program, but I know that the homeless in the state of Indiana we're a pilot program for kind of creating a clearinghouse, or basically it's all of the different, because we have a lot of homeless agencies here in town, and they're all pulling together, and they're going to have a one central entry point for all the homeless people in the area, and then through that entry point, they're going to do a thorough assessment to get them fed into the right agency to help with homelessness. Now, I'm not saying this right, probably. What is it called?
I think Aurora is handling that, because I know Lucas Place is no longer doing the assessments for placement in Lucas House. They're actually being done through Aurora.
So the only reason why I bring this up is, to me, it sounds like a great concept for homeless, and obviously veterans that are homeless that they get in there, they're going to be connected with our veteran agencies for homelessness. But I kind of wish sometimes that we could do the same thing for veterans, that we had like what they're doing, and we have a one-stop kind of thing. And the VA is really trying to be that, but then we have these community programs, that we're not all connected with. But I think that the homeless, this pilot program that we're doing in here, is a really cool idea, in this whole pulling everything together and then linking them out, and just one entry site. Are you familiar with that one?
I'm not until just now.
Me either.
Whose responsibility is it that the veteran knows to come to VA and register?
All of ours. I mean, the military will tell them register.
Who in the military tells you, hey, you need to go to VA and you need to register?
Oh, that's part of ACAP.
Yeah,
and
part of
you're supposed to see a VA representative as well. That's supposed to relay those things to you. It is a part of the out processing.
The out processing might take several months if it's active duty. Like with my husband thing, they put him up PDY in Fort Knox for 2 weeks.
But it's going to resonate more after they get out and they get back a little bit with us to tell them to register. It's 1,000 things that they're going to tell them to do, and they're not going to listen to that, or they're not going to hear that, or they're not going to be ready to hear that. It's us when we kind of have those interactions with them.
Okay.
I have a question.
Sure.
Do they have a follow-up if a vet doesn't register? Do they have a system where they follow
like
up
case
with?
management, a case
Yes.
management.
There's the OSOS program.
Like
Well,
case
but what they're talking
management
about,
would
you mean
follow
like if a veteran separates and then
they don't follow up with
if
the
the veteran
suggestion?
doesn't take initiative to follow through, it's not going to happen, And I think part of it is also the vet, it's like everybody's saying, getting them in there, getting connected, but then part of it is just where they are. They don't.
As far as the case management, you had mentioned the OAFOF can provide that case management to the newly returning veteran as far as getting them linked with what they need at the VA. But again, they do have to
The
go
military doesn't have any process for saying, hey, it's been here, have you done these things?
Yeah.
It sounds like it's partly some way we can help our vets too, by just asking, have you registered at VA? I'm always surprised when I have to meet with student vets that sometimes they're not. I'm like, you're young, what's up? Oh, well, I don't know, I haven't done it yet.
In that first 5 years,
Another good example was the Veterans Justice Outreach has done a lot of work, at least here in this area, has done a lot of work to try to get our jails and our police officers and our, just our whole police law enforcement oriented to the idea of asking if someone, once they get connected into the legal system, are they a veteran? Because a lot of times they're not used to asking, and so veterans may be eligible for services somewhat even while they're in jail. And so we've been working pretty hard on this end to try to get them thinking about to ask those questions when they get caught up with the legal system. And I think that like the ERs are doing a much better job asking about if they're veterans, because then that can be the link to get them connected. So okay. I'm really going to get in trouble now, so I'm going to move on. How, Lori and the veterans, how were your family and friends impacted by your experience in your road recovery?
They're very much affected. I don't care, whatever you're going through, it's a family affected thing. I do know that 20 years ago, when I was going through all that suicidal part, at one point I had my youngest son in the car with me and was going to pull in the garage and kill us both. And as I was driving down the street, I seen my brother, and I thought, no, I can't do that. I got to stop and talk to him. And I stopped and talked to him and forgot about all what I was doing and went straight home. I'm telling you, it was by the grace of God that I made it through it at that time, and had no idea that I had any place to go to get help.
Well, the follow-up question to this, so I'll just lay them both out here together so I can save time for it. But the follow-up question is, how are family and friends impacted? And then the next piece to that is, what services are available for family, and how are those services helpful?
I don't know of any services available to my family.
The family is very much affected. Since I've been home, especially this last time, because I made a career out of this. The anger, frustration, the alcohol abuse, my anger. I did take a lot out on the family. Just hollering and being, I'd go hide in my room, my man cave. I wouldn't talk to nobody for days. And they're very much affected. They see all that. They see you when you're drunk and stupid. And so, yeah, it's very much so. And as far as follow-up groups, the only family thing I know is the caregiver program. And they keep saying, "Oh, go to Al-Anon, go to Al-Anon." So.
Well, I would like to speak on that behalf is the caregiver support that I've received. There's been one particular lady that has followed up with me consistently, whether it's emails or phone calls, and making sure that I'm aware of the resources that are available to me. So there are, and then the vet center as well. Wait, man, they have a component for family members as well? Yes.
Yes.
Okay. What's it called?
Home front.
Oh, yeah.
So where the point man meetings are at the same time, there's also the home front.
6 o'clock at Crossroads Christian Church. On the east side.
If you look on the website, there's two websites. There's the national Point Man website, just it's pointman.org, Anyway, I like it because you go in there and there's all this trumpet fanfare and it's got all this soundtrack and things. It tells you a little bit about the history of Point Man. But the other Point Man website, they just created a new one for our area. It's called Newburgh, Point Man of Newburgh, or Newburgh of Point Man. Am I saying that right? Anybody know?
I don't know.
You know?
Something like, I
It's
think it's
Newburgh Point Man.
Point Man, I think.
If you type those two words in together, you're going to get it.
I think it's interesting hearing him say that because I'm 37. I'm the child of a Vietnam veteran who, until I was 12, was alcoholic, physically abused us, very angry. I always thought, why is he so mean? I hate my dad. Unfortunately, my dad died of suicide 10 years ago when I was 8 months pregnant with my first child at 55. He'd be 65 today. And it took me growing up to realize all these things we missed. We came from a very small town of 600 in Newport, Indiana. My dad was, in the Army, and after he got out of Vietnam, went to work for General Motors and finished his career there for 25 years, but he never got treatment, and he always had these issues escalating inside. And I could always tell that whenever he got upset and angry, it was just like he needed that time to de-escalate, and then he wished he wouldn't have reacted that way in the first place. And I think that's where all the mental health issues finally happened when he retired. He had the time to think about all those things, and once he spiraled out of control, we had 6 months to try to save him, and it just didn't happen. We tried every avenue to try to save him, and it just didn't happen. That's why I'm working suicide prevention today with Southwestern. But one of the things that I've always thought about since I've been at Southwestern was with the military is if you're going to sign up as, a veteran, if you're to sign up and be in the military and be a veteran one day, when you sign up, why don't they think about what your life's going to be like while you're in the military and what your life's going to be like when you're done? And why don't they assign you right then as they're, setting you up to a recovery specialist or to a reconnection specialist when you get out? Why don't they think about that when you go in? They know what kind of life you're going to be living, which is totally outside of a civilian life. And then they know what you're going to return to, and they can say, okay, when they return, we have set them up with this reconnection specialist. And this is either a person they can call nationwide with this database that have all the information about the veteran, or local places they can go that has all of this one-stop information. That they can go in there and talk to this specialist and find out all the different avenues. And they can call this person as much as they need to and use the service as different things arise, whether it be employment and then mental health or divorce or all those different things that happen. And then the wife would have that brochure too and say, okay, wow, my husband is assigned to this reconnection specialist. He has someone we can talk to who knows everything we need to know about all these different things we're having problems with. It doesn't make sense that they wouldn't set you up with that when you're signing up. They know what kind of life you're getting ready to go into and what you're going to try to deal with when you get home.
Have you ever spent much time talking to a recruiter?
I mean, it's hard to think about what the military's mission is, and at that time, they're not looking at it that way.
Right.
They're looking at what the mission is, what numbers we have to plug in, what bodies we have to fill. That is their main thing. They don't look at it like that. And I know in the Fort Campbell area, and I think this is military-wide now, they have this big program called One Stop. Is anybody familiar with One Stop? Mm-hmm. Well, the thing about One Stop, you literally still have to be connected to someone in the military. I was dating a service member going through relationship issues. Though I was not in the military, I was allowed to go with him to a therapist. But the connection with that was that he still was in the military. That's the only way those services was afforded to me as someone, and I wasn't even married to him. We were dating, but I ran into some of the same issues with things he experienced through the military, but only because he was active duty, and One Stop is set up for retirees and active duty members, but for the ones who wasn't fortunate enough to retire for whatever reason, and then that's another thing too. Depending on how you were chaptered out the military, if something is wrong and you feel, well, maybe I do have a disability, so I need to be rated. Well, newsflash, if you got out the military and you got paid any type of money, separation pay, you will not even receive your benefit until you pay that money back. So though you get a quote-unquote rating at a certain time, you won't see your first pay for that until you pay that money back. So if you got $25,000, you got out and you separated, you're not even going to see your first disability check until that money is paid back. And depending on when you came in, you may or may not have to pay interest. So it's just a lot of discouraging things there.
I think your points are well taken. I think the challenge is the way that system, I mean, I think it's going to take a lot. I mean, right now, recruiters, if you're a recruiter, you're, I think, when we talked to my husband's a recruiting commander for a couple of years, and right now, compared to what it was when my husband was in there, they've got recruits all, people really wanting to get in, and they're downsizing because the quotas are really low. So it's like a field day if you're recruiting right now because there's so limited number. But they do have, the recruiters' jobs are so much pressure on you. So they just don't. They have so much pressure on them. Okay, 5 minutes. And the two most important questions that we have to ask in less than 5 minutes. So,
Here she is.
Oh my gosh. It's not time yet.
It is time. We started 11:15 in there. Sorry.
I've only got 10
I am
after.
the timekeeper.
No,
Ten after.
seriously.
10 after.
Yeah.
Quarter after yet. We're supposed
It's 10
to
after.
There at quarter after.
Okay.
We'll walk fast.
Okay. I told you. Okay.
Can I add something?
What do you want community partners to know that will help them in their mental health work with veterans?
Ask if they're veterans when they're in, with people in the ERs or people coming through it all.
You want to say, what do you want mental health people to know? What do you want your community partners to know that will help them with mental health work with veterans?
Asking questions.
Just stop asking
No,
questions?
keep asking
Keep
questions.
asking questions.
And just going back to together about the family resources, there's a stigma, I think, too, for the family, and we can't be afraid to ask for help as well. Being an East 7 wife, you just keep quiet and you do what you're told. So it's important to reach out.
Okay, and last question. Please give 3 pieces of advice for family members that may help them better understand what you're going through.
Three pieces of advice.
I try to be more understanding that there is a problem. It's not them, that it's the soldier. So do not take it personal when you're going through that. I know that's hard to do, but
anything else?
I think participate. We do, all of our services are free. We do family and marriage therapy. We see single moms, single dads with their children. And I think it's a huge eye-opener when families participate together and they start to realize, the behavior that he's displaying is a commonality with a lot of other veterans that have deployed, and it's not just him, or her. And I think that helps the family.
Okay, I wanted to say something. She touched on some really good things here. I thought part of healthcare reform and going to electronic records, I went to a conference way before it was ever passed, and she spoke in Washington, D.C., advocating for healthcare reform, but I thought it was like if somebody is in the emergency room, they can just click into a database and see, this is the doctor they saw last, this is the medications they're taking, so that they're not prescribing brand new medications. Whatever happened to the electronic component part of healthcare reform?
Well, I know we have it, but it's It's not easily, the VA, we have it. The VA has it. I've got GPS electronic records, but I sure can't see what the doctor said the last time I went in. It's kind of funny how they control that. Okay, I'm going to get in big trouble, so everybody has to go. Move on in, Terry. Good. What is it? About what?
Thank you, Sherry.
Where are we going after the video?
We're going to go video. Very good.
Thank you.
Family question. You don't need to call the SEER number? That is, kind of
number, but if you need your phone number there, I'll give you a call right back. Here's your website. Yep, that's my email address. Yeah, I'll okay. Appreciate it.
Right. I came in and talked about that suicide prevention I have and all this stuff about her.
And what?
Okay, I'll call that number on the side here, because I want to see if I can come talk to.
Further, I didn't get to my 17-year-old.
Now I'm become like, well, I'm on my own.
He'll get better.
Over there in Hillsdale.
I'm going through that too right now because of my
at 17
drinking and my anger and all that.
It'll get better. Like at 17, I ran to. I came here to USI to go to college. Had to get away from my family. I had to have that separation from my dad. And then as I grew, because I'm now 37, I started to realize more about life dynamics. And my dad, though, also put in the effort to apologize and really let us know that he was working on things and trying to heal. And so, you know, I think it's all about that. You'll know why.
I've tried to do that already.
And she'll come around if she is recognized. All you can do is, I just had to finally forgive my parent. And then once things got perfect, like then he was taken away. And then that's where I became angry and I was mad at him again because he allowed us in and he asked me one of my times I got back I wanted, and then he took himself from it.
Okay,
And that was
right.
angry. You know, so I had to go through counseling for that. Because I was so upset because he did it again. He affected us again, you know? So,
It was somebody, and I can't mention names, from Southwestern, Stepping Stone, that asked me, you know, because he knew I was a veteran, of course, because he's a veteran too. And then he goes, have you been to the VA? Have you signed in? Have you done all that? I had the rating already, but I'd never gone past the paperwork. I'd never gone into the VA to get treated for the nightmares,
Good for you. It should not hurt.
anxiety, the depression, the anger.
yeah, all that.
And
All of that.
now I got like 8-9 bottles of pills, and they work.
Definitely, that's where my dad failed in the fact that he had that strong
I know, that's what hurts, and that's
taking
one
medicine
thing
when
that
it felt like it and not
separates
tell
me from
anybody he wasn't
everyone else
taking it. And
when
it's,
the difference is
yes,
my
and
session
so, long story
Some
short,
of them
he never
have-
stayed on it for it to work for him.
Yeah, and you know as well as I do, if you start taking like Fixer,
that I don't
which is an antidepressant, or Paxil, once you start taking it, just take yourself off of it, you go 10 times worse in the depression.
We had all of that. He was like up in the night killing things, having terrible PTSD. He used to be a hunter. You kill a deer, a deer, you know, a deer, whatever the situation was, to the point where he would start to get down and call and have total flashbacks of Vietnam, of trenches and blood and death and it totally was opposite of, because he suppressed it. We knew that there was this box on the top of the closet that had all the Vietnam pictures. And when I knew Dad wasn't going to be home, I told the box to look through some of them and put them back so he would find them, because he never would tell us. So I was like, I had to know what was going on. And so I find some of them. There are pictures of him in the jungle, pictures of him in his bunk, pictures of him with big guns and a bunch of shells, you know, ammunition all across him. And he had this warrior look to, you know, and
They pump you up to make you feel like you're invincible, and then you get out and they just leave you.
Yeah, and so he found his
Especially
way.
Vietnam guys.
Yeah, and my grandmother was an alcoholic, and she died of cirrhosis of the liver. She killed herself through drinking too much, and he had to be flown home for that funeral when he was 21. So there's a lot of circumstances that led up through a lot. But yeah, I mean, I think that for your daughter's sake, you just have to keep being, maybe write her letters. I don't know what you can do. Do something to let her know that you recognize her anger and that you're working on it. And that's all you can do. And that's all I would have wanted to hear from my parent. That's all I would have wanted to hear my dad just say, I recognize what I did to you, and I recognize it was wrong, and I'm sorry, and I'm working towards one day that we'll have forgiveness. I would have loved to see, I would have loved to gotten that from my parent, you know.
It's all communication, isn't it?
Yep.
Pretty much.
Everything, making the connections, all of it.
Because I grew up with everything. I had an in-ground swimming pool, I had a basketball court. My dad was outside, you know, fun to my friends, but inside the worst, you know. And so my friends were like, oh, you must have this great life. No, I don't. If you only knew how he used to beat on my mom, beat on me, beat on my brother. It was terrifying.
That's one thing I have not done to my wife. I have not touched her, but the verbal abuse.
Yep. Oh, yeah.
Oh, yeah.
Bad done, bad
yeah.
done.
That's really.
And I haven't hunted, I was an avid hunter, but I haven't hunted since I've been back. They've taken I've gotten all the weapons out of the house,
Yeah,
because of the PTSD.
Yep. yeah, absolutely.
And I don't hunt. I just started fishing again.
Good.
It's been, what, since 2010, it's 5 years
Yeah.
now.
Just slowly take baby steps and realize who you are again, like find yourself again, and find out why you enjoy every day and, you know, things like that, you know, and be honest with how you feel. Be honest about it all the time. It's okay to have terrible days, but you're going to want to give days too if you're honest about it. You're not suppressing it.
Yeah, we're learning a lot now. I'm going for human services addiction specialist.
Yeah.
And that's what I'm going. I'm going to stop at Ivy Tech, go to USI, and get my bachelor's. So you might see me in Southwest
Yes, I
or
hope
at the VA.
I hope so, but I'm serious. Like, if your daughter is keeping a letter from you with the I love Bill, write one. Surprise her. Only do something she never expects.
That was surprising.
Yeah. She probably won't.
He said, so I thought it was strange when I had several, he told me, he said, I thought it was strange when I had several meetings with Dr. White, and then she turned it over to somebody who never met with me, and I kept thinking, that person's never been in any meetings, so how do they know what to do? He said, and that could be why none of this is working out, because you had Yvonne had a vision, Ann had a vision, he had a vision, and it wasn't coming together.
Okay, this room got 2 questions emailed to them, so I guess it was worthwhile.
This isn't any.
Nope.